Everybody, sorry we're a little bit late, just a little minor technical blip, but we've overcome that with the wonderful technology that exists in Guernsey. Sunshine outside, sunshine inside, sunshine for the weekend, long weekend. Let's hope everybody enjoys it. Now, a week ago, we set out what we saw as the rules from the 1st of July. We're still on course for that. We intend to be on course for that. But because we're dealing with a worldwide pandemic, if we do have to change, if there are any matters that arise this coming week or in the coming weeks, we will do that. But at the moment, we're still going to be in the position that we were announcing last week. We'll look at UK regional trends, we'll look at certain other matters, and Dr. Brink will address those in due course. But what we said last week was that this week we would give people the opportunity to ask questions, and we've had really lots of excellent questions. Because of the time available to us, we've narrowed them down to about 20. The question master will be, last week I called her Deli Alley, this week she's a mixture of Jeremy Paxman and Fiona Bruce, will be Deputy Salisbury. But Dr. Brink and I will endeavour to ask most of the questions, albeit Deputy Salisbury will chip in as appropriate. As I say, July looms large. I just want people, because there are people who are still going to be concerned, because that is only, 5 weeks or so away now. We are saying that our overwhelming, and it will remain our overwhelming concern, is the safety of the people of the bailiwick. Enough from me, Dr. Brink.
Thank you very much. And as usual, I'm going to take you on a quick run through some of our recent trends and the recent update, and starting off with the vaccination programme. So we are very happy with the progress of the vaccination programme. Over the last few days, we've immunised over 1,000 people per day. So really, really encouraging. So in total, we've now, and this is the data as of close of play yesterday, we've delivered 63,791 cases. So really encouraging. And if we look at our dose per 100 population, all ages, it's at 97 per 100 population. So good progress, very satisfying, and again, a debt of gratitude to everyone working on the programme. What I've all done over recent weeks is I've looked at whole population, over 16, over 18, and over 50 uptake. And starting off with the over 50s. So the over 50s, most of those are going to be in the phase 1 of the vaccination programme. So just to remind you, phase 1 consists of all over 50s together with the clinically at-risk group. So what you can see from that is that 94% of over 50s have had at least one dose of vaccination. That's really, really encouraging. It goes down to, if you look at the over 18s, 79%, over 16s, 74%, and our whole population, 62%. So what you're seeing with the progress of the vaccination programme, we are moving ever closer towards vaccine-induced herd immunity. So a very, very encouraging update on the vaccination programme. Now, I'm going to spend a little bit of time now just talking about the current prevalence and the trends, because I know for the next 5 weeks these are going to be very important. Now, what you can see, as always, is a changing picture, and this is the update that we've just done at 12 o'clock today when we've looked at the prevalence levels, and this map will come into effect at 1 minute past midnight tonight. What you see from this map is that, unsurprisingly, Wales, southwest, southeast of England are all still Category 2 countries, as are the Isle of Man and Jersey. What you do see from this map, however, that in addition to the Republic of Ireland, the northwest of Scotland is now a Category 4 region. So it's moved from a Category 3 to a Category 4 region. And I'll show you some more data on that in a little more detail in a moment. The rest of England and Scotland, together with Northern Ireland, are all Category 3 regions. So that shows you where we are today. If we then look in more detail at a regional level, if you look starting off at England, and you can see two grey dotted lines. The one grey dotted line, the lower one, is the prevalence of 30 per 100,000, and that, of course, below that is a Category 2 region. And the second dotted line is 100 per 100,000, and of course that is the threshold for categorisation as a Category 3 region. So the green and blue lines you can see from the southwest and southeast of England are both below 30 per 100,000. Indeed, they both are Category 2 regions. What you're seeing with London, which is illustrated in red, you've seen a decline in the number of cases, but it is plateauing off, possibly slightly increasing in London at the moment. The top orange line is Yorkshire and the Humber, and you're seeing that come down. But what you are seeing in the northwest of England, and you can see that illustrated by the black line, is the number of cases going up. So I think that just gives you an idea of how the situation is still unstable in certain regions. So if you go to the situation in Scotland, at the bottom you see the Scottish Islands, and there's very little COVID activity there. But what you see in the rest of Scotland, in the lower line, you see the southeast of Scotland. But what you see, which is of concern, which is the top green line, which is the southwest of Scotland, and there you see the number of cases have now increased to above 100 per 100,000, and that makes the southwest of Scotland a Category 4 region. So again, you can see how the southwest of Scotland dipped really nicely, was coming down nicely, but in recent weeks has seen that uptick in infection. And again, it just demonstrates the volatility of the situation. So Wales is doing really well. So you can see the single or the dotted line of 30 per 100,000, and all of Wales is now Category 2. So Wales is doing very well. And then if you look at the Republic of Ireland, Northern Ireland, Isle of Man and Jersey, Jersey have had a few cases recently. The Isle of Man are down in their cases. Republic of Ireland, you will see, has stayed above 100 per 100,000. That's illustrated in green, but you can see there that it came down and then went up slightly and is now going at a reasonably stable rate, but above a prevalence of 100 per 100,000. And Northern Ireland is below 100 per 100,000, but again is fairly stable and not particularly decreasing. So I've separated the regions out because I thought it was important for you to see the regions in the differing forms, but also I think it makes it clearer when you look at the map. Now, of course, as we move on to the 1st of July, we're moving away from prevalence as the prime indicator of risk, and we're moving towards our proposed border control strategy, which is the blue region, which aligns with the common travel area, going on to green, amber and red. And if we then look at the border strategy in more detail, the blue region, of course, aligns with the common travel area. But within the blue region also is people who have travelled from a green list country, and they have a full vaccination history and they're 2 weeks post their second dose of vaccination. For those groups, it is still our intention to have no testing and no self-isolation requirements. Importantly here, the travel history. So we need to have the travel history completed on the travel tracker for the 14 days prior to entry into the bailiwick. Now, as ever, there is a public health override, and if there are areas that we're concerned about, either because they've got rapid growth or outbreaks, we can apply an override, and that could be a regional override within the common travel area. We wouldn't want to make a whole area recategorize it. We might recategorize regions within the area. So if we then look at going on to green and amber, so that again aligns with the UK traffic light system, but again we will be looking at the criteria ourselves as well. So they're the UK green list countries for green travel, but also allowance for those people that are fully vaccinated. So a step down from amber to green if you have a full vaccination history and 2 weeks post your second dose of vaccination. For those people, it's just a test on arrival, isolation until you get a negative result, and a test on day 7. And then you'll be in passive isolation until the receipt of a negative result on day 1. The travel history again goes back 14 days. With the amber, it's an amber risk country and again aligned to the UK traffic light system, and you'll have a test on arrival on day 7, but with self-isolation till the receipt of a negative result on day 7. As ever, the travel history of 14 days before is important. For red countries, we are not having an allowance for vaccination. That is because of the concern about any emergence of variants of concern, and we feel that we need to be cautious here. Those individuals will have a test on arrival and a test on day 13. Now, importantly here is the travel history for 2 weeks. But if someone, for example, has been in a managed quarantine hotel in the UK for 10 days and then returns to Guernsey after their negative testing and release from the managed quarantine hotel, they'll only be required to do an additional 4 days. So it's 14 days in total from the departure from a red risk country. So that then gives you a summary of where we are, both with the current prevalence, with our vaccination, but also reminding you about our border controls. But one of the things I wanted to end up was just highlighting some of the key interdependencies of the Betawix blueprint. So, of course, we're looking at our border restrictions, we're looking at increasing travel, and that is aligned to our increasing vaccination in the vaccination program. But I do want to reassure people that we are still monitoring the situation really closely. We will still have our contact tracing program, and within our contact tracing program in the second half of this year, we'll be including sequencing for variants of concern. We're looking at our local capacity for the detection of variants of concern, and indeed we hope to have that operational towards the end of July. We've got our surveillance programs. They're focused on people at the moment, but we're looking to switching in the second part of the year to a sewage surveillance. We are saying that we need to learn the good lessons from COVID. So what kept us healthier? So the hand washing, the stay at home if you're unwell, the respiratory etiquette, all really important as we move forward. And so those NPRs, those interventions, we need to still consider, we need to still take into account. So it's not just we're abandoning everything. At the start of this pandemic, most of our heavy lifting was done by our non-pharmaceutical interventions. So by the social distancing, the hand washing, all of the things you're familiar with. Now what we're looking at is the vaccination doing most of our heavy lifting, with some contribution of NPRs in the form of your hand washing, stay at home if you're unwell, and so on. So I hope that gives a summary. Thank you.
That's a brilliant summary. Thank you very much. Just 2 points before I pass over to Deputy Salisbury. First is the travel tracker. Please complete it. Please encourage people to complete it. Otherwise that causes a delay, especially as we hopefully will get more people travelling, because it'll just cause delays. So please, 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 and that will continue to be important, will be perhaps even more important post the 1st of July. And secondly, perhaps a more prosaic but still a practical matter, if you're looking to travel by taxi from the airport or the harbour, please pre-book it, because often there aren't any spare taxis, and again that can cause a concern and a delay. But anyway, enough of me. Now over to Deputy Salisbury.
Thank you, Deputy Fairbrash, and thank you to everybody who sent in questions for today. We've had far more than we can ask, but what we've tried to do is put them into categories. And we've had quite a lot of questions from parents. We've had a number of questions about testing on arrival and quite a few questions on vaccination. So we've picked out about 20, and I'm now going to channel my inner Fiona Bruce and start to ask them. So to kick off, first from Matt. Given the vaccines do not prevent transmission of the virus, what other measures will be in place to protect unvaccinated children from the debilitating effects of long COVID? Dr. Brink.
Thank you. So I think the first point to emphasise is there is evidence that vaccines do provide some protection against transmission of the virus. Recent evidence has shown that people who become infected after having received the vaccine tend to have lower amounts of the virus within their respiratory secretions. So we know there is some protection against transmission. It's not absolute. But I think Matt raises a very, very important point in that we do need to think of the broader protection. So in addition to vaccinating the adult population at present, the more people we vaccinate, the more protection will be afforded to children. So I think that's important. But also, as I said at the end of my slides, this is not a singular approach. So we're looking, for example, at the positive lessons of hand hygiene, respiratory hygiene, stay at home if you're well. We also have our surveillance programs. So our surveillance programs are particularly directed at trying to hunt out infections. So it's both testing of asymptomatic groups, but also that low threshold for testing of symptomatic symptomatic patients. So no matter how mild the symptoms are, we'll offer a test. So it's a combination of vaccinating adults together with the general community measures to try and prevent transmission, together with our surveillance program to try and detect those infections. So all of that serves to help protect children. And I think what I'd finally like to say about the vaccination program in particular is we are vaccinating at pace, and coming up to the bank holiday weekend, we have had people asking if they could perhaps reschedule their vaccination because they want to enjoy the hot weather, travel, have a day out. And whilst we really, really understand that we all want a break, what we'd ask people to please prioritise their vaccination appointments. So work together with us to get as many people vaccinated as we can, because by doing that, we're protecting our whole community. So thank you.
Good point, Dr. Brink. So next from Penny. What will happen when children are symptomatic or infected with COVID-19? Will you send classes or year groups home from school or early years settings is showing signs of COVID or positive tests? Dr. Brink.
I think, again, this is a good question, and I have to say it's something that we've discussed in our team meetings, is how we will manage a single case, a cluster of cases. So it is something that we're planning for and looking into. I think the first important thing to say is it's fortunate that children don't tend to get really ill from COVID, but other important thing that's come out is they don't also tend to be super spreaders of COVID. So I think looking at the facts and the science behind the situation is important to inform what we do. Now, should we have a case, or indeed a cluster of cases within a school, we would look at each situation on an individual basis. So we'd look at the case, where they were, how many contacts they had, what type of contact they had, and we'd do a risk assessment of that situation. And it might mean that we just isolate a small cohort of individuals, we might do something broader. We'd do everything we could to prevent school closures. So it would be a specific risk assessment, but bearing in mind that would also take into place that we now have an increasingly vaccinated population. So it's not a one-size-fits-all, and we'd look at each situation independently. So I know that's not a precise answer, but that really is how it will be.
Thank you. We've got a couple more for Dr. Brink. We will have some for Deputy Fairbrash in a minute, but these are definitely the questions for Dr. Brink. Anne asks, what measures are being put in place to protect vulnerable children, e.g. those with autoimmune diseases undergoing chemotherapy, since children are not having the protection from the vaccine at present? And I understand it's still possible for those who have been vaccinated to pass on COVID-19.
Yeah, so this is a really difficult situation for parents whose children are undergoing chemotherapy or indeed are on other treatments such as steroids for autoimmune conditions. And it is very difficult. What we have done in the early days is we've sought to cocoon these children. So by cocooning, what we've done is we've vaccinated around their adult carers and adults within their family. So the first thing you're doing is bearing in mind a lot of transmission will occur within that household setting, is we have sought to protect that child within the household setting. Now, there is data coming out on COVID in immunocompromised patients, and in general, they don't seem to have significantly worse outcomes than other individuals or other children. The caveat here is it does, to a degree, depend on what stage they're at their treatment, what type of treatment they're having. So that can be very important. So what we're saying to parents under those circumstances, have a specific discussion with your healthcare provider. The reality of the situation is a child on chemotherapy or on high-dose steroids may be susceptible to a broad range of other bacterial and viral infections. And what those carers will be doing, they'll be advised by the healthcare providers how to prevent infections in the round in these children. But I understand, I've spoken to quite a few parents in that situation, and I understand how distressing it is. So we start off with the cocooning, trying to stop the adults getting COVID, then look at specifically how we can protect that child through general protection against bacterial and viral infections, but it's a difficult one.
Thank you. I know how difficult it's been for those families who have in that situation over the last year, but thank you for that. And a good question coming up from Louise. There is a hesitancy over vaccinating under 16s. Does this not show that the vaccines aren't safe? Why such hesitancy for younger people? Please can Dr. Brink explain?
Well, I can try, and I think it goes back to the first principles of the COVID vaccination programme, in that we were vaccinating to prevent morbidity and mortality, so severe disease and death. The fact that they reduced transmission has been an additional extra, which is obviously very welcome. So the first trials, vaccine trials, were in healthy adults, and indeed a lot of trials, when you're looking at new medicines and so on, will be in healthy adults. Now, one of the things I always say is children aren't mini adults. So they have different anatomy, they have different physiology. And so what is happening now is those trials looking at efficacy and safety are now being done in children. What we will be doing is, because we link in with the Joint Committee of Vaccination and Immunisation, we're looking at the results of those trials, and we will follow guidance from JCVI. But it's really not so much this hesitancy to use the vaccine, it's that we need the data from the trials to be able to use those vaccines safely in children.
Thank you. I hope that's been useful. Now on to a few questions for Deputy Fairbrush. So, the Barnes family ask, if both parents are fully vaccinated but the child isn't, as there's no vaccine for that age group, does that mean the family can't take advantage of the reduced self-isolation, or are there exemptions for children?
Absolutely not. The parents' vaccination record will convey the status on the children. Same with carers. So therefore, if the parents or your carer are vaccinated, the children takes the benefit of that. There's no other restriction.
So that's great. Next we have questions about travel, and first up is one from Chloe. Can you please explain your decision to not test incoming and returning travel to Guernsey from July?
Well, I think that point we've emphasised over weeks, really. That's the vaccination progress. And Dr. Brinks explained earlier in one of her slides that 94% of over 50s have had at least one dose of the vaccination, and that's continuing in the sense that people continue to get vaccinated. And we've heard this expression, herd immunity, etc. The point is that by July, another hundreds of people will have been vaccinated, and therefore we're moving away from the testing procedure in that sense to the fact that people have had a high level of vaccination, as they have it in the UK.
And I think it's true also that the practicality of being able to test everybody coming in on day 1, day 7 test, but we just wouldn't have the capacity to do that. If you think the volumes of people coming in have been reduced way down over the last year, but as we open everything up, we'll have much greater volumes coming through, just wouldn't have the capacity to do it.
And I think it's also focusing on the fact that we will still be testing in the traffic light system.
Yes.
So for red, amber and green, we will still be testing. So we'll be focusing our testing on the areas that we feel we need to pay closest attention to.
Yeah.
Yes, I mean, clearly the not testing relates to common travel area and being in the UK. So now on to Susan. Can visitors elect to have a test on arrival and pay £25 even if it isn't necessary by law?
It's a bit early to say yes, because again, it's the point that Deputy Salisbury and Dr. Brink have made about doing something that's practical. It may be practical by the 1st of July or shortly thereafter, and if so, we may well do it. But at the moment, it's still something that's being looked into.
Thank you. Next one. Kay says, I'd like to know if people who haven't been vaccinated will be allowed to travel to and from Guernsey to the UK.
Well, the answer is yes, they will. But we do encourage, as we all say, I know it's not a broken record, it's a record that must be continually played, that people should have vaccinations if at all possible. But the answer is yes, they will. But we've got a low threshold in the sense for testing. By that I mean we've got a high standard of people that we require to be tested, and we'll continue to have that policy for the foreseeable future.
Yeah, and in terms of vaccination, if you come from an amber or green country, that will enable you to either have no isolation. If you come from a green country through to the UK, then you can have the same status as where you're coming from the common travel area, so a blue zone, and if you come from an amber area, you could have the same rights in terms of testing than you would if you came from a green area. It's just a vaccination gives that greater assurance that we can do that for people coming through.
As deputy soldiers, you've got the bonus. If you've got your if you've had your vaccinations, you can go from green to blue, or you can go from amber to green. You know, you've got that, so that again is another reason to have the vaccines.
So Natasha asked one of those that you have to get your head round a bit. If someone leaves a Betawix shortly after the second dose for a week, will they be regarded as having a full vaccination history on their return?
Well, the answer is no. We only consider someone fully vaccinated 2 weeks after the second dose of the vaccine, because that's the scientific evidence.
Next one from Guy. Are we to receive a form certificate as proof that we have received a full vaccination?
And again, I remember Dr. Brink made this point several times in our press briefings. Yes, we're developing a formal certificate which aligns with those being issued by the UK, and they're going to both be physical and digital, and they'll be issued to all islanders who've received both vaccines. We hope very much to have this on track by early July.
I will give Deputy Fairbrush a bit of a rest now. We've got a few questions for Dr. Brink, and we're halfway through. Mr. Breyer is asking a question I know many have also wondered about, and I think this is a good one to hear it direct from the horse's mouth, as it were. Would it not be wise to delay our more open travel policy from the 1st of July a little bit until all adults over the age of 18 would have had 2 doses, particularly given the concern in the rising number of cases of the Indian variant in the UK? Now, I know we don't like calling it the Indian variant. I mean, it's a bit like we used to call it the Spanish flu, and it never came from Spain. It's actually B16172. But that's what we've been told we must say. We're not allowed to say the Indian variant, are we, Dr. Brink? So over to you.
Yeah. So I do think this is a really good question, and this is an area that we're keeping a really close eye on. So as ever, it's a risk and benefit. So we try and weigh that up really closely. By the by the beginning of July, all of the people within the bailiwick over 18 years of age will have had the offer of at least 1 dose of vaccination. All of the people in the group 50 and above, so that is the group that are most likely to get severely ill, require hospitalisation, indeed die, will have had 2 doses of vaccination. So we feel that we'll have a high level of population-based protection. It's not absolute, and we will be watching the B16172 variant, but also other variants that emerge. And we'll watch that carefully, and we'll continue with risk analyses. But we think the risk balance, as we move towards July, with so many of our population having been vaccinated, 94% of the over 50s have received at least 1 dose of vaccine. We think it is reasonable to take that next step forward. So I think that's all I can say with regard to that risk balance, but we're looking at a population that is increasingly protected through vaccination, and one of the highest levels of vaccination worldwide.
Thank you. And the next question comes from Annie. Considering the vast majority of the elderly and vulnerable are now vaccinated and therefore already protected from getting seriously ill or dying, why is it deemed necessary for younger, fitter and healthy people whose own immune systems will protect them to be vaccinated?
Well, I think there are 2 reasons here. First of all, it's absolutely right that younger people are less likely to become seriously ill and die from COVID. That does not mean that they will not become seriously ill or die from COVID. So there are always a proportion that will become seriously ill and die. The second thing is you've got the issue of long COVID. And with long COVID, it doesn't depend on disease severity. It's quite unpredictable how long COVID develops. So you've got to think of long COVID on a young population. So those are the individual reasons for vaccination. But there's also a population community. The more of our community that is vaccinated and the more of the community that becomes protected through vaccination, the less likely we are to have virus circulating within the community. So by getting vaccinated, you're also protecting your community. So you're protecting yourself from the potential, albeit low, of severe disease or even death, but also from long COVID, but you also protect your community. So I think there are two reasons to look at that.
I think that's a really good point, Dr. Brink. It's not just about ourselves as individuals, it's about protecting others. And we're talking about people who might have, there'd be reasons why they can't have the vaccine.
Absolutely.
It's those people that we're trying to protect. So it's the whole Guernsey together. We're doing it for the community. Now, Mandy has had COVID and asked an interesting question. Does having had the virus and therefore built up some antibodies, plus having one vaccination, entitle me to the same travel benefits as someone who has not had COVID-19 but has had 2 vaccinations? Dr. Brink.
So the simple answer is no. We have to standardise our travel recommendations. So to have vaccination exemption to move down a category, it's 2 doses of a vaccination and 2 weeks after the second dose. And we have to be very clear, we can't have all sorts of bespoke variations because we've no idea how effective those will be. So we need to standardise those. So unfortunately, no, it doesn't.
Thanks. Now Peter asks, and that's not Deputy Fairbrush, by the way, how long will the COVID-19 inoculations last until the protection becomes less effective, and will there be any long-term medical effects?
So with regard to how long the protection lasts, it's difficult to say because we don't have all of the studies, and there are studies that are being done at the moment looking at the duration of immunity but also looking at the COVID vaccine booster programs. So at the moment that data is not yet known. We think it lasts at least 6 months, probably longer than that. With regard to long-term effects, we are not anticipating long-term effects. The available evidence is that the vaccine is safe and effective. The side effects, particularly the thrombotic side effects in younger people, have been well described, and we're using alternative vaccination for that group.
Thank you. Now, this one's from Steve, and he asks, is it correct that the lack of beds in the PEH is due to people being treated for the side effects of having the COVID-19 vaccination? Now, I'm going to answer this one, having been president of HSC for a few years, and I could absolutely say categorically that that's a no. And would it were the case, I'm sure that nothing will have changed since I left, that committee would be open and honest about what the situation was. The truth is, and I know that we have clearly got backlogs in terms of operations and things that need to be done as delayed as a result of all the things that we've had to delay because of COVID, and that they're really trying to get people through there, getting their operations through the hospital. And occasionally we can get those peaks and troughs, and I know it has been particularly busy over the last few months, but that has nothing to do with people's having side effects from the COVID-19 vaccine. So I hope that's been useful for people. Anyhow, after Steve, we have Stephen, who asks, please could you advise if France will be treating Guernsey the same as the UK, or will there be specific or different rules for travel between Guernsey and France? This one for Deputy Fairbrush.
Yeah, and the answer is yes. That's currently France's position, and we see no reason, do not expect that to change after the 1st of July. In other words, we expect it to continue.
Thank you. And here's a good question from Angela for Dr. Brink. Will students about to start university from September 2021 be able to be fully vaccinated before they leave?
Yeah, so I anticipate the majority will. There might be a few that have birthdays in late August that will have had 1 dose of vaccination, and they would then receive the second dose within the UK. So we would look at those groups individually, look at those individuals separately. And though we have a very good relationship with the Department of Health in the UK, and it's easy for us to then arrange for the second dose to be administered in the UK. At the moment, the guidance is for the over 18s. These are being looked at. A childhood immunisation programme is being investigated further. So it might be that this changes. We'll keep you all updated on that.
Thanks, and it's probably worth adding, and particularly a reminder to a student that I know quite well, it's a good idea for students, if they can, to register with their GP, and then if they can do that in the UK, then it means that they could get the jab either here or in the UK, wherever's convenient and wherever they are.
So, young Mr. Salisbury, you've heard that.
Yeah.
And just to add to that, sorry, Deputy Selby, just to add to that, is some students we know, and I've already been contacted by a few, will have had one dose already in the UK. Yeah. If they then come back before their second dose is due in the UK, we'll then pick that up and do the second dose for them here. They just need to let us know that they've had one dose, and we'll then book them in at the relevant time to have their second dose here. So we're trying to not have a one-size-fits-all. We're trying to actually make it as bespoke as we can for individual students.
Thank you. Now, Andrew and Jill ask, for those of us who do not wish to own a portable smart device, will there be a paper version of necessary documentation, such as a travel tracker?
I can deal with that. The certificates that are being prepared as proof will have a paper version, but the travel tracker is slightly different, as it's a form where, like now, you'll need to input your information. If you don't have a device, you can do this on arrival at terminals in the port, and our welcome team will help you. But if you do have a device, and we encourage as many people as possible to have a device, we really encourage you to do it beforehand, because again, it makes travel through the airport easier for you and easier for everybody else. Very importantly, if you create a travel tracker at home but don't have a portable device with you, please bring in your login details so you can be set up on the terminals.
So basically, yes, you can be helped if you don't have one, but really it gives you far more convenience by doing
absolutely.
So penultimate question, and it comes from Kirsty. Is the government taking the concern of the Indian variant of B16172 seriously?
Yes, absolutely. We're taking it very seriously. We take the emergence of any variant of concern very seriously. So not only are we looking how it could affect contact tracing processes, we're looking at how we diagnose infections. So we are taking it seriously. We're monitoring the situation in all of our neighbouring jurisdictions very carefully, and we will be responding appropriately. So we consider it a serious development. I think how I would say we're not panicking, and I think that's important, but we are monitoring it closely, and it is concerning.
Thank you. And last but not least, we have a question from Hayley. If we have community cases, will you lock down for a third time?
So we're in a really good position not to have to go into another lockdown because of our testing capacity, our surveillance programs, and our contact tracing. And if I remind everyone what happened in October, November last year, we actually had 11 community cases during that period of time, and we did not lock down because the situation was under control. That was different to what happened in January. What is different now, when we compare to January, is our population is largely vaccinated. That is absolutely a game changer. So we would do everything possible to avoid another lockdown. We're optimistic that we could avoid another lockdown, but obviously what we'd have to do is assess the situation as it arises. If there's anything the pandemic has taught us, it's the uncertainty of the changes, the uncertainty of the situations. Things change very rapidly, but we're in a very, very good position to avoid another lockdown.
Thank you, Dr. Brink, and it just will show all the work that will still continue even after the 1st of July, and we can hopefully open all the borders up, so things will not be, and we know as we've been developing the government work plan how much more time and effort will be required over the coming year or two, or maybe longer. But well, that's it for questions. I don't think Fiona Bruce has much to worry about with her job on question time. But thank you very much for that. I hope people have found it useful. And back to Deputy Fairbrass.
Yeah, and thank you everybody for their questions. Thank you, Dr. Brink and Dr. Salisbury, for their input in what I think has been a very important and useful session. But also, can I just make one point? Guernsey Together, and Dr. Brink has said it very gently, there's a lot of work that goes on just to get somebody to have their vaccination. Please only ask that it be changed if you've got a really, really good case. If you want to play golf or you want to go to Sark, that's not, in my view, I'm only expressing my view, not the view of my co-panellists, that's not really a good enough excuse. Because otherwise it means that people have got to be inconvenienced, people already hardworking are being put to unnecessary extra work. But that's a matter for you. If you feel that you'd rather play golf than have your vaccination, that's a matter for you. But I'd ask you actually to think of yourself and other members of the community and Dr. Brink and her team. Anyway, questions, please. Ewan.
Ewan Duncan from BBC Guernsey. Some great questions from the public there. Just one I want to touch on at the end there from Kirsty, who was asking about the Indian variant. We're obviously seeing reports yesterday of a couple cases, we believe, in Jersey. As you've said, you're monitoring it and you will continue to look at it. Is it a concern that it's come as far as Jersey?
I think it's a concern, but not surprising. So I think with travel, you're inevitably going to detect cases of different variants of concern in different jurisdictions. And I think it's detecting the case and taking the appropriate action, which is the important part. And we would detect cases on our arrival. We would self-isolate, we would isolate them, obviously any positive cases, and indeed we would send them off to for sequencing, as Jersey have done.
Juliet.
I'm Juliet from the Guernsey Press. Thank you very much for the uptake figures. I think everyone's found that very interesting to see. It seems like it's been a very high figure. I suppose that's 19 out of 20 of every over 50s has had their vaccine. Had you expected it to be that high? And have you had any feedback about why the other 1 in 20 people have not had it?
So I think, first of all, we are very encouraged with the uptake, but bearing in mind a lot of our other vaccination programs also have a high uptake. So our MMR program traditionally had an uptake of 90 to 95%. So I think by and large, the community is really engaged in preventative programs, and I think that's important and encouraging for the community. I think why individuals haven't taken it up, it's difficult to know each person's individual status, and I think with such a high uptake, I think we're content to accept that high uptake. What we would say to people who've changed their minds, because there are some people who think they've missed their chance to change their minds, is to let us know. Because if they have changed their minds and they want to be vaccinated, we might not be able to get them in straight away because we're using different vaccines for different age groups. But what we're doing is creating a list of people who say, well, actually, I've changed my mind. They're over 50, they're entitled to a certain type of vaccine, is we're trying to put those together and then run some small clinics to vaccinate those individuals. So we're trying to be as flexible as we can. What we can't do is, if someone wants their jab at 2 o'clock today, we can't guarantee that to them, but we will try and accommodate it. So if people have rethought and said, I really do want the vaccine now, it's important to recontact us, and we'll see how we can facilitate that.
Heidi?
Yeah, I just say I'm not surprised at all. We've had a high uptake, and I think it was back end of last year when we started the vaccine programme. I think I said I was looking and hoping that we'd have probably one of the highest uptakes in the world, and I don't know what the rest of the world is like from that point of view. I know our vaccination programme is ahead of all but about two or three other countries, but I'm pretty sure the uptake will be up there as well.
Because that shows we've got a community that we're proud of, and that what's happened here is, as Deputy Salisbury and Dr. Brink has said, is what we expect, because people are responsible.
Hi, Louisa from Channel TV. For people arriving on the plane, for instance, coming from different regions, if someone tests positive on their arrival, does that mean that all the passengers on the plane would have to self-isolate through contact tracing?
Mm-hmm. I'll answer. Yeah, so we have a formula that we follow within contact tracing. So we'll look at a certain number of rows in front, to the side and behind. So we won't then self-isolate the whole plane. We'll self-isolate within a ring around that individual. So not necessarily the whole plane, unless we've got compelling reasons to do that. So it normally would follow the formula as to who was in 2 meters contact or 2 meters distance for more than 15 minutes. But we can vary that if there's a particular matter of concern. But that's a general rule of thumb.
Well, I mean, that's a procedure we've had for a long time.
Long time. Ewan?
Just touching on something from the last press conference, I think a question from my colleagues about the percentage of the population you expect to be vaccinated, and you said about 70%. Are you able to clarify that? Is it 70% the whole population, including children, or 70% of those that are currently eligible for it?
You
So-
mean about herd immunity
yeah.
levels?
Yeah, yeah.
I
Yeah.
think it was about 70 for
Yeah.
the whole population.
So determination of herd immunity is a little bit up in the air at the moment with the increased R number of some of the variants of concern. So you're looking probably at anything from sort of like mid-70s up to 90%, depending on what the R number is. So actually, the precise definition of what constitutes herd immunity at this point in time, it's difficult for me to put an exact figure on. But if you'd asked me before the emergence of the variants of concern, I'd be saying 70-75%. With the increased transmissibility, you're looking at a higher level, possibly into the 90s. So I know that's a waffly answer, but that is the information we have
It's a
to
very good
date.
answer because it's the best one that can be given at the moment.
On the current uptake of people taking the vaccine, we look like we're going to go beyond 70.
Yes, yes, we would hope so, yeah.
Comfortably by the look of it. Next question, Juliet.
I know governments across the world have been struggling with the human rights aspect of vaccine passports, basically allowing freer movement for people who've been vaccinated, but people who don't choose to vaccinate possibly not having as free a movement. I think it's something which a lot of governments seem to be struggling with to try and find the right balance. What did you look at when you were making these considerations, and why did you feel that what you've currently come up with is the right balance between restrictions and... Yeah.
Well, the passport is something that the idea is it enables people to travel. Dr. Brink has made the point in previous broadcasts. We're looking at with the passport, call it what we will. It's aligned with the UK. It's aligned with others, so that it's got to be acceptable in other jurisdictions. There is a balance, and nobody's castigating somebody from not having a vaccination. We're not saying that, but other communities will require a vaccination document. And that will be their rules and regulations as much as ours. Heidi.
No, it really goes back to all that we've been doing through the CCA from the beginning, and considering whether what we're doing is appropriate and proportionate, because all of what we've been doing is taking away people's human rights, and that's weighed heavily on us, as we've told people that they're not allowed to go out the houses except for essential reasons. We've gone through all that. So really it's the giving people who've had the vaccine the more freedom for movement, and saying, you know, you could be treated like instead of green, you're in the blue region because you've had a vaccine, because of the risk, and it's a risk not just to that person, it's to the community as a whole. So it's all done on that risk base and justifying why we can do that. And it's a bit like saying if you've got COVID-19, you can't travel. I mean, that has taken a human right away, but you're doing that because you don't want to compromise the rest of the people who might be on that plane or boat. So it's all around that, and that's been at the forefront of all the decision making since March 22nd, when we first sat down and considered it.
Yeah. I mean, it is human rights. It's such an important concept. It weighs heavily. In the 7 or 8 months I've been involved, all my colleagues who have sat on that panel have, or that authority, it weighs with every single decision we've made, and I'm absolutely certain that was the same for the previous 7 or 8 months before. You know, it really is a concern. It'd be great to have no restrictions, but sadly, that's not possible at the moment. Next question from anybody.
Can I just ask how many questions you received from the public?
Several dozen. I don't know quite many. I know they were filtered through before we even saw a shorter list. So yeah, quite a few. So I'm really, grateful to people.
Yeah.
That shows the engagement that we're still getting, and we appreciate it. And that's why it's part of what we're trying to do, especially now as people are seeing we're going to a completely different regime here, that's very different from what we've been used to over the last year. Just so people can get their questions out, and we might do more, but really this is why we wanted to say what we were doing last week, so we've got the opportunity to answer those questions before we get to the deadline day.
I know that obviously things have been going very well with the AstraZeneca vaccine and with the Pfizer vaccine just across the way in the COVID vaccine centre. But I know that you've been looking possibly some data about when we're hoping to see the Moderna vaccine rolled out. Do we have some dates about when that's likely to be going in arms?
We do, and today I can answer the question that I failed to answer for the last 2 press briefings to you. So the Moderna vaccine we get in smaller numbers, so we have to make sure that we've got enough for a first and second dose for individuals. So we plan to start using it towards the end of June and into July for the younger stage group of people.
Anybody else?
And where exactly are we on the age groups currently?
So the invitations are going out, I think, to the 20 to 29-year-olds, but I'll have to confirm that with you. We can ask Joel to confirm that afterwards.
Any other questions from anybody? Well, thank you, everybody. Thank you very much. We won't be broadcasting next week. It'll probably be at least a fortnight before we have another briefing, but we will keep everybody informed. As I say, things are going to change, no doubt, but every change will be well publicised and well intentioned and detailed. But thank you very much for your questions. Have a great weekend.